All of this news out of the CDC comes as preparations underway for New Year's Eve celebrations, of course, all across the globe. So let's bring in Dr. Susan Bleasdale, Chief Quality Officer for the University of Illinois and Health Sciences System. Dr. Bleasdale, we enjoyed having you on so much last night. We brought you back. Thanks for being here.
Thanks for having me again.
Well, we know some cities already canceling their New Year's Eve celebrations. What is your advice for people who still want to gather?
Well, you really have to be cautious because I think we know what's been helpful. And even with this recent change, as was highlighted in the removal of isolation at 5 days, it is with masking continuing. And that's because we know that masking is really very effective in preventing transmission. So your New Year's Eve plans should include masking. Hopefully you've already been vaccinated, because should you acquire the infection, you're going to be hopefully protected against severe disease. And you want to limit the number of people that you're around. And you want to know that there is still risk. Adding a test before you gather is helpful. However, we have seen some ongoing transmission from the most recent Christmas weekend that people have gathered with testing before, and then within 24 hours, someone has become symptomatic. And so this Omicron variant is very transmissible. So you really need to choose wisely how you're going to gather, who you're going to gather with, and understand the risks. That a gathering with people unmasked is a potential for transmission right now because of the high level we have within our communities.
Well, Dr. Bleasdale, I want to piggyback off of something you just said there, talking about people gathering for Christmas and then just a few days later testing positive. Are you anticipating that this surge in cases will continue? I mean, we're just a few days removed from Christmas, now just a few days away from New Year's, and we know people will gather.
Right. So we anticipate it's going to continue to grow. We've seen increases this week related to the last weekend. We anticipate people will still gather. I think we're just hoping that people will scale down their gatherings so there are not as many people that become positive, because what we're seeing is with large gatherings, there is transmission to multiple people, versus when we had the previous variants, it could be 1 or 2 people in an encounter, but we're talking about 10, 15 people that are infected in one instance. And so we are hoping that people will choose wisely. I think with vaccination, hopefully it will be mild for most people. What we do need people to understand is that vaccination protects you against severe disease. It does not protect you against getting infected or spreading it as well. Right. We continue to see people that despite vaccination and boosting are infected. And so I think that there is this assumption that I'm vaccinated, I can gather with other vaccinated people and there's no chance of infection. That's not true. Unfortunately, it's very disappointing for us, but we really hope that you choose wisely. We're seeing dramatic increases this week. Our hospitalizations have doubled from the previous week. And so it's really important, especially those that are vulnerable to severe infection, those that are not vaccinated, right, and those that have conditions that put them at risk for severe disease or their immune system is not very strong, that they can't fight it even with vaccination.
I almost wish we could put on a banner that, vaccine does not mean you can't get it, does not mean that you can't pass it. That was such good information there. All right, let's get back to some of these changes from the CDC. Yesterday they changed quarantine guidelines. Today, drastically reducing the number of cases linked to Omicron. Now, obviously, need to acknowledge data changes, information changes, but are these changes causing more harm than good, particularly with a public that's already pretty COVID fatigued?
I do think that this is very hard for the general public right now. Lots of questions with this change yesterday, especially right before New Year's Eve. This creates a lot of confusion. People are seeing the headline of shortened to 5 days. It's really important that the CDC is still recommending that you mask around everyone for a full 10 days. So it's not really shortening the isolation period, but it's creating some freedom, and that you could potentially go outside because your risk is lower in those last 5 days, but it is not zero. And I think it's just a little bit hard, I think, for people to apply this guidance. There are some that have very mild disease and are very low risk for transmission beyond day 5, and that masking is going to be enough. It is hard to apply that in a one size fits all guidance that many of us are having trouble helping the public, our patients, our healthcare setting, which had a different recommendation that came out on the 24th that requires a test for return. So it's a lot of confusion. I think just for the public, I recommend people use caution. There is still risk with this recommendation, and the recommendation is not to stop isolation at day 5, but to continue masking around others. And that means do not gather with others unmasked when you are recovering from COVID, and dining and drinking on New Year's Eve would be a high-risk event for the others you would be around.
All right, Dr. Susan Bleasdale, thank you so much for joining us once again. We appreciate it.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.